So for those of you who don't know, polymyalgia rheumatica is actually quite a common condition, and it usually manifests with headache, and sometimes a headache can be really quite strong, and usually neck ache and ache across the top of the shoulders, and sometimes joints as well. It's an inflammatory condition, meaning that there's inflammation, and we don't really understand it properly, to be absolutely blunt. At least I don't. Maybe there are some people in the world who do. And for years and years and years, ever since I was a medical student, we'd been treating it with just a set of tablets called steroids, and it's very effective treatment. Okay, so it turns out that about 5 to 10% of all MDS patients get inflammatory problems. So there is a definite linkage. Sometimes people get rashes, sometimes people get joint pains, and it looks like all the world, like rheumatoid arthritis or some kind of arthritis. Sometimes they get polymyalgia, sometimes they get inflammation of the cartilage, polychondritis. So there are a number of different manifestations. And we don't really understand this. My own prejudice, and it's prejudice, I don't have evidence, is that it's probably the MDS that comes first, actually, and that the blood cells that an MDS patient is making, especially those blood cells that are responsible for controlling inflammation or causing inflammation, because sometimes inflammation is good for you. If you have a infection, bacterial infection, typhoid, whatever, malaria, whatever it is, your body needs to kill those cells. Well, that's an inflammatory response. That's a beneficial inflammatory response. Okay? So the blood cells cause the inflammation. Well, if your blood cells are being made in a corrupted way because of MDS, you might imagine that they're not very good at controlling themselves and controlling how much inflammation they cause. Does that make sense? That's my prejudice. Okay, but you know, sometimes people have presented first with polymyalgia, and then only later it's been clear that they've got MDS. So the clinical history sometimes is the other way around, but that doesn't mean that the causation was that way around. Yeah. And not everybody with polymyalgia will have MDS. Some people will have that inflammatory response just because, for other reasons. So it's complex, but I think they probably are linked, actually. So 80% of Caucasian patients will have an unrelated donor. 4 out of 5. So if a sibling is older, in their 70s or late 60s, or have ill health or whatever, and you have a perfectly matched unrelated donor who's in their 20s, most transplant units would choose the unrelated donor.